Okay, you can bet that in recent months, the focus has been on coronavirus testing, and perhaps you've wondered, okay, what happens to those samples? Well, it comes to laboratory professionals like myself. So I'm here today to explain to you the Department of Medical Technology, where we educate and train future medical laboratory scientists. Okay, oops. So I am Sheri Gon. My degrees include a master's in public health as well as the medical laboratory science certification. I work in the University of Hawaiʻi Mānoa Johnny Burns School of Medicine, Department of Medical Technology. So the laboratory is one of those places where people don't really get to see it. It's a very hazardous place, right? There's lots of biological hazards as well as chemical hazards. There's certainly a lot of things that we do not want to expose the casual observer. So you might wonder what happens in a medical lab or who works in a medical lab, what happens to your specimens, and why are these lab results so important? So perhaps you've seen House, or perhaps you've watched CSI, or maybe Monsters Inside Me. So all of these programs tend to focus on the science in healthcare. So a lot of this science happens in those medical labs. If you like science, then perhaps you should consider a career in the medical laboratory science program. So as medical laboratory scientists, we perform medical testing to diagnose illness or injury, monitor treatment, prevent disease. And over 70% of all of medical decisions made rely on laboratory information. Medical laboratory science are in high demand in all states across the nation. Also, in a typical medical laboratory, these are the different practice areas. Microbiology, where we study microorganisms. Phlebotomy, where we collect blood specimens. Blood banking. Hematology. Coagulation is the study of blood clotting. And chemistry. So there are different levels of education in the medical laboratory. And these are the different people that work in a medical lab. Lab assistants, also known as phlebotomists, only require a high school diploma. Medical laboratory technicians, as was mentioned earlier by Sheri Souza, is an Associate of Science degree. Medical laboratory scientists, which is the program that I work in, is a Bachelor of Science. The medical laboratory director can be a MD or a PhD. If it's an MD, these are physicians with a specialty in pathology. So many of the graduates of our MedTech program may also go on to earn advanced degrees in business, public health, and education. So I'm one example of a graduate that went to get a public health degree. So let's look at these different skill sets. And the lab assistant phlebotomist, as I mentioned, was a high school diploma. They can earn a certificate or on-the-job training. So there's a certificate program over at KCC where you can, in a couple of months, get a certificate of completion for the phlebotomist program. Your responsibilities would be to collect the blood specimens, and oftentimes these lab assistants are trained to assist others in the medical lab. So they might process the specimen, or they may load the specimens onto different analyzing equipment. The MLT is the Associate of Science Laboratory Professional. So if you're at KCC, it's an Associate of Science. They are the ones that perform much of the lab testing. The Medical Laboratory Scientists, which is the Bachelor of Science degree, they perform pretty much all of the testing done by MLTs, but then they can also go on to perform the highly complex testing, and they can also go on to supervisory or management positions. So the LA phlebotomy is at KCC, but as I mentioned, there are a lot of laboratory employers that will provide on-the-job training. So places like Clinical Labs of Hawaii or diagnostic laboratories. The MLT program is at KCC. The MLS program is at UH Manoa. By the way, we're the only undergraduate program in the School of Medicine. And we are located at UH Manoa because a lot of our students require courses that are offered only at Manoa. We were asked if we wanted to move to Kaka'ako with the School of Medicine, but that would have been a logistical problem going back and forth. So we chose to remain at Manoa. If you want to become a pathologist, there's the UH Manoa School of the Johnny Burns School of Medicine MD program. So how do you become a medical laboratory scientist? You go and earn your MLT degree first. So you would go to KCC to earn that Associate of Science. You can be concurrently enrolled at KCC and UH Manoa. When you graduate from KCC, if you have a 2.5 GPA or better, and you're nationally certified as a MLT, you can apply to the UH Manoa program. You would then complete 2 years in the MedTech program to complete your Bachelor's of Science. There are a lot of other graduation requirements like the Gen Ed. So I would suggest if you intend on becoming a MedTech, you get in touch with the faculty advisors right away so that we can make sure that during your time as an MLT student, you can be accumulating enough Gen Ed credits at KCC before you come to UH Manoa, okay? So these are some of the major courses when you enter the MLS program: clinical chemistry, hematology, immunohematology, which is also known as blood banking, clinical laboratory management, and medical microbiology, which covers parasitology, virology, and mycology, the study of fungus. So in chemistry, it's a very automated type of practice area in the lab. So you'll see a lot of these instruments that are used to analyze specimens. In hematology, their focus is on counting the different blood cells and to differentiate them. So if you can identify these different blood cells, you can diagnose different disorders. In immunohematology, also known as blood banking, we're concerned with the common blood groups. We want to make sure that the transfusions are compatible with the recipient. If there's any incompatibility, we investigate it. And we often prepare blood products for transfusion. Management is concerned with operations, finances, education, and training. Whereas microbiology is identifying bacteria, parasites, and fungus. We determine antibiotic sensitivity, and we can determine viral infections. So why should you consider a career in MLT to MLS? Well, when you graduate from KCC with your MLT, after 2 years of education, you can choose to start working. Okay, so you can start earning money as an MLT. That's about $24 an hour. And if you choose to continue education and get your bachelor's in medtech, remember that the medtechs, the ones with the bachelor's degree, can assume positions of responsibility as supervisors or managers. So your earning potential is more. So after you work as an MLT and you decide, oh, you want to continue your education, you can apply to the University of Hawaiʻi Mānoa as a MLT to MLS, and you can complete your bachelor's in 2 years. So you would enter our medtech program as a junior. I would suggest that you get as much of your prerequisites out of the way at a community college, since tuition is cheaper and classes are smaller at KCC. The medtech program at UH Manoa has a long history of graduating students since 1940s, I think. So 90% of our graduates pass on their first attempt at the certification exam. You might wonder, where can you work? The most typical place of employment are hospital labs, followed by reference labs. So these are the huge reference labs that you pass by, when you drive on H1 and you look to your right as you're driving to the leeward side, you'll see DLS is in Halawa. So that's a reference lab. There are government labs too. The military, all branches have their own medical system and have the medical labs. The national CDC or FBI have medical labs as well. Those are more for investigation. State public health labs, and ours is located in the Heights, Aiea Heights. There's also veterinary labs and instrument companies that will hire graduates from the medtech program. So hospital labs, hospitals are places where people are because they have some acute illness or injury. So it's often stat work. So if you are able to thrive in that sort of stat environment, then working in a hospital lab is someplace that offers, very different days. You never know how your day will be. One day there's a bleeder, or maybe there's more ICU patients than usual. So your hospital labs are always busy. Whereas reference labs, they're the ones that get all of the routine tests. So it's a lot of volume. So the pictures that you see here is, I believe these are from DLS, and the work is plentiful, but it's all routine. Okay, so it's not so much acutely ill or injured patients. Okay, so it's all of the routine testing that goes to reference labs. So this is a state lab photo. You can see where someone is working under a hood. So the state lab is often referred to when there's communicable diseases. So if you have a sample of a communicable disease and you need to have it verified, let's say you suspect salmonella and your preliminary testing has identified it, you can send it to the state lab where they will record that occurrence and then send that off to the national CDC. Our furry friends need healthcare too. So there are veterinary labs that service our pets. I need to remind everyone that there's a big difference between academic programs and professional programs. So I know that a lot of you may want to, you envision going into a doctoral program. Okay, so maybe your vision is to become a physician, and you take an undergraduate degree like biology. Okay, that's an academic program. meanwhile, there's all these other people who are getting their biology degree thinking that they'll apply to the School of Medicine, but only 70 students get accepted into each cohort. So every year, only 70 students out of 2,000 applicants get accepted into the School of Medicine. So what do the rest do? If you have just a biology degree, well, I'm afraid you can't work in a hospital setting. All of the medical professionals that work in hospitals are from accredited professional programs. So these are programs like nursing, med tech, rad tech, the medical assisting programs. So all of those different programs are accredited. They provide the education and the training necessary for work in those different types of disciplines. Okay, so if you're concerned about finding a degree that gets you job ready, then look for a professional degree program. MedTech is one of those, and the MLT program at KCC is another. So all of our professional programs are accredited, which means that we must meet national standards. And all of our students, when they graduate from us, must demonstrate competency. And that includes clinical training that's provided after the formal education is done. And then all of our graduates must be certified before they can work. So you're wondering, what's the job outlook for med techs? There are more laboratory professionals that are retiring than there are qualified people to replace them. So there's a lot of baby boomers like me who's looking forward to retiring, but we're also creating a workforce shortage. So there's a lot of vacancies all across the nation. And there are new opportunities in related fields. There's also progression to advanced degree positions. So imagine if you're a graduate of MedTech, you know a lot about diseases and how diseases are diagnosed. A lot of our graduates who went on to becoming physicians had an easy time going through their 4 years as a med student because they had a leg up on understanding that part of their education. So I wish that there were more people that knew about med tech as a possible degree and they could become really great doctors. So what does this mean for a newly trained lab professional? Well, you have your choice of work environments. You could choose to work in the hospital, in a reference lab. You could go elsewhere, travel the country as a traveling tech. So there's also employer incentives because of this workforce shortage. There's sign-on bonuses or moving expenses. Once you get your certification, you can find work anywhere in the United States. And if you choose to go military, you get good rank and pay. And there's opportunities for promotion. A med tech can earn about $30 an hour in experience. And then as you accumulate more experience, you can earn more. So you know you're med tech if you want to help others, you love science, you have an inquisitive mind, you enjoy problem solving, you like working in an ever-evolving field, if you're accurate and reliable. So we are located in the Biomed building on UH Manoa campus. So if you take East-West Road, it's all the way down East-West Road. Give us a call at 956-8557. You can also check out our website, and I have it here. If you have any questions that are for other careers that are health related that we didn't cover, you can always go to the Pre-Health Advising Center or PAC. It's open to anyone. You don't have to be a UH Manoa student to seek their advice. Okay, so I left that information here. You can email them or check out their website. They're located in Sinclair 108. Okay. So I can.
Sheri, thank you so much. Oh, I'm sorry. Go ahead.
No, I'll just quickly go through some snapshots of what the lab looks like. And you can go ahead and start talking.
Okay, that's good though, because that was one of the questions. Was like the actual lab experience. Does your program have internships built into it?
After you graduate with your bachelor's, you are then placed into the clinical setting where you get the hands-on experience. And so that's about 5 months of clinical training after you graduate.
Okay. What could a student who doesn't, because this seems, I was for one love those kinds of shows, House and CSI, but what would a student be able to do to see if this is something they would like for their career? Like a class they could take or something they could do to find out more if it's something that they could see themselves in?
Okay, both the MLT program and the MedTech program have an intro class. So at KCC, that's MLT 100. MLT 100 is open to anyone. You don't have to have prerequisites or you don't have to be in the program. It's a way for the people who are interested but not sure if that's what will be their interest as a career. They can take that course. At UH Manoa, it's MedTech or it's MEDT 151. Okay, so MedTech 151. So it's the same as the KCC MLT 100. It's a way of introducing people who are not familiar with the lab, what we do, the sorts of different occupations that are associated with our skills.
Okay. Do you happen to know the percentage of, I mean, maybe just at JABSOM, but the percentage of medical students who came from the MLS?
It seems like every year there's one or two. I don't think a lot of people know about medtech as a career, frankly.
Yeah, I mean, I could be one, like, this is so fascinating, but I wouldn't have known where to look.
Yeah. I can tell you a really sad story. There was a student that went through the chemistry program at UH Manoa. Remember I said there's a difference between academic and a professional program?
Mm-hmm.
Unfortunately, that student went through the academic program not knowing of the professional program. And that person went to Kuakini to seek employment as a chemist. And unfortunately, the HR had to tell the student, well, sorry, you graduated with a bachelor's in chemistry, not a bachelor's in med tech, so you can't step into the lab. You have to come from that program.
And how far back would they have to track to go to switch that career path? Would they have to take the last 2 years of the MLS to kind of switch back into it?
In those situations, they can enter as a second degree student. I neglected to mention that 3 years ago, the MedTech department decided to create a second degree entrance. So if you have a degree in, say, chemistry, microbiology, or biochemistry, and you couldn't find work, then you can apply as a second degree student to the MedTech program. As long as you can show us that you meet the prerequisites, that you've taken chemistry, organic chemistry, biochemistry, and microbiology, then we'll let you enter as a junior. So 2 years, you'll be done with our program, and then you can start working.
Yeah. Can you give any advice about students coming in light of COVID, about classes, the change of things, just in terms of how classes are presented, things like that?
So just like KCC, the UH Manoa instructors are looking at how the different rooms might be, we can practice social distancing. So all the rooms have been looked at and have been enumerated how many students can safely be in there. So the small classes, I have no problem with, but any class that has 50 students or more will probably be online.
Okay.
It's really hard to maintain your distance in that situation.
Yeah. Well, Sheri, thank you so much. This is a lot of great information.